Hi everyone, my name is Maxime Campbell. I'm a physical therapist working with male pelvic floor patients. So today I wanted to share you guys a situation I had recently. So I have a patient called Mr. Lopez, and he came to the clinic, and actually you get some of those patients who's very affected by all this situation. Told me, Maxime, I can't live like this. I have a hard time sleeping. I can't go out because I go to the washroom too often. And he has what I call the big bundle. So meaning low back pain. He had an abdominal surgery, so very weak abdominals. High urinary frequency, we're saying nocturia 3 times a night, and small bladder capacity. So for a case like that, it's very easy to be overwhelmed, and it's hard for them to understand the situation. You get into that situation, you explain them something, and you see they just don't understand it. So I'm going to show you guys a trick. It's one of the tools I use the most in the clinic, and it's the whiteboard, because if they understand what's going on, they can get and follow the game plan, especially for a rehab like that. That's going to be long since there's a lot of things to work on. So I'm going to show you guys today the tool I use the most using the whiteboard. So that's a drawing give them. So Mr. Lopez, here's what we need to do. That's the game plan. So what you need to understand is the first thing that's going to affect your symptoms is the spine. The spine is where you got the control center, and the communication is going to come from there. You got nerves that connect to your bladder via plexus. So that's the first thing we got to focus on. Second thing, your bladder is within the abdomen. So the abdomen is where the pressure is going to go on. The bladder needs to be able to expand and contract. So if you got weak abdominals, if you cannot control the pressure, all that pressure on top is going to affect your bladder and your symptoms. That pressure also is going to be reacted by the pelvic floor. So you got here the pelvic floor. This is where you got the valve that controls where the urine comes out. So that pressure can affect the pelvic floor, but that pelvic floor can also affect your continence and your symptoms. And last but not least, there's a bladder that actually got to fill and contract. So in this case, we had to increase the capacity. So after that, he understood all the components we needed to work on, and that's why the whiteboard is just one of the main staples I use every day at the clinic with my male patients, male pelvic floor patients. So that's just one idea and one example of how you can use it at your clinic. So give it a try and let us know how it went.